Before your next dose of amlodipine, know this. A few ordinary choices can quietly undermine your blood pressure control or amplify side effects. We'll walk through 7 things to avoid, so your treatment stays effective and safe. The medicine is effective. It lowers blood pressure, reduces chest pain, and helps protect against stroke and heart attack. But its effect can change depending on what you eat, drink, or combine it with. This is the part many patients never hear. Certain choices can weaken the benefit of amlodipine, while others can increase side effects in ways that feel sudden or confusing. And this is why one patient feels stable, while another ends up dizzy or swollen, even on the same dose. In this video, we'll highlight 7 important things to avoid while taking amlodipine. Some are everyday foods. Others are over-the-counter medicines people use without a second thought. Miss them, and your treatment may not work as expected. Stay with us. Number 4 is a common item in the kitchen, and number 7 can become critical if you ever need surgery. This video is based on peer-reviewed research and information from the Mayo Clinic, Cleveland Clinic, NHS, PubMed, and the FDA. This is for educational purposes only and not medical advice. Always talk to your doctor before making any changes to your medication. Number 1. Excess salt. Amlodipine is a widely prescribed antihypertensive agent, particularly effective in older adults due to its vasodilatory properties. However, one often overlooked dietary factor, excess sodium intake, can significantly diminish its therapeutic benefits. The effects may first appear through seemingly minor physical changes: indentations around the ankles after wearing socks, shoes that feel increasingly snug as the day progresses, or a modest but unexplained weight gain, perhaps 2 to 3 pounds within a matter of days. These are not random or benign. They may indicate peripheral edema, the accumulation of interstitial fluid, most commonly in the lower limbs. From a physiological perspective, the mechanism is clear. Amlodipine functions by relaxing arterial smooth muscle, thereby lowering systemic vascular resistance. In contrast, sodium promotes fluid retention, increasing intravascular volume. This excess volume elevates hydrostatic pressure within capillaries. When that pressure surpasses the capacity of the capillary walls, fluid extravasates into surrounding tissues, resulting in swelling. This interaction is particularly relevant in older adults. Studies have shown that up to 1/3 of individuals over 60 exhibit salt sensitivity. In such cases, even modest sodium intake can cause significant elevations in blood pressure, effectively counteracting the intended action of amlodipine. Consequently, patients may assume the medication is no longer effective, despite perfect adherence. In reality, the drug is pharmacologically active, but its benefit is being undermined by dietary habits. Clinical vigilance is advised when the following signs appear: progressive lower extremity swelling, rapid weight gain over several days, new or worsening shortness of breath. These may suggest that fluid retention has escalated from a minor concern to a cardiovascular risk factor. Evidence-based guidelines recommend the following interventions: limit sodium intake to no more than 2,300 milligrams per day. Ideally, 1,500 milligrams for patients with hypertension. Avoid highly processed and prepackaged foods, including canned soups, cured meats, sauces, and salty snacks. Encourage home-cooked meals using fresh ingredients, seasoned with herbs, lemon, or garlic rather than salt. Advise patients to elevate the legs in the evening to promote venous return. Implement daily weight monitoring to detect early signs of fluid imbalance. In summary, while sodium is an essential nutrient, excess intake poses a clear and measurable risk to patients on antihypertensive therapy. Proactive dietary management, particularly regarding salt, remains a critical component of long-term blood pressure control and cardiovascular health. Number 2. Alcohol. Alcohol is a common yet often underestimated factor in patients taking amlodipine. Both share one key effect: vasodilation. When combined, the result may accentuate the drop in blood pressure. Sometimes this lowering goes further than intended. The warning signs are usually subtle at first: a brief wave of dizziness when standing, an unexpected sense of lightheadedness, or a noticeably faster heartbeat after just a single drink. These are not random events. They reflect orthostatic hypotension, a sudden fall in blood pressure when moving from sitting or lying down to standing. This is why some patients faint after what seems like a harmless drink. Clinical data supports this link. According to FDA labeling, dizziness affects about 3% of patients taking 10 milligrams of amlodipine daily. The likelihood may increase when alcohol is added. NHS guidance also warns that alcohol can worsen dizziness and fatigue in people prescribed this drug. The mechanism is straightforward. Amlodipine relaxes arterial smooth muscle, lowering vascular resistance. Alcohol acts in a similar way. It dilates blood vessels and blunts the body's autonomic response. Together, these actions reduce perfusion pressure. In some patients, that can lead to fainting, falls, or near syncope. Older adults face higher risk. Their metabolism of alcohol is slower. Their nervous system responds less effectively. And for those also taking beta blockers or ACE inhibitors, the combined effect is even stronger. What is the practical takeaway? Abstinence is not required, but moderation is essential. Most clinical guidelines advise no more than 1 standard drink per day. That means 150 milliliters of wine, 350 milliliters of beer, or 45 milliliters of spirits. Alcohol should be avoided during the first weeks of therapy or when doses are being adjusted. These are times when dizziness is more likely. Patients should watch for persistent dizziness, unusual fatigue, or repeated lightheadedness. If these symptoms occur, their healthcare provider should reassess the treatment plan. In summary, alcohol can subtly, but meaningfully, compromise the stability and safety of amlodipine therapy. Understanding this interaction and using alcohol responsibly is vital for maintaining long-term blood pressure control. Number 3. NSAIDs, the common painkillers that undermine the effectiveness of amlodipine. They are present in nearly every household medicine cabinet: ibuprofen, naproxen, over-the-counter painkillers that seem harmless. We use them to soothe a headache, relieve back pain, or get through a difficult day with arthritis. But if you are taking amlodipine to control your blood pressure, these everyday pills could be silently working against you. And the signs? They are very easy to miss. Your blood pressure, once under control, begins to creep up again. You notice that the sock marks on your ankles are deeper. You feel more tired than usual, even though your amlodipine dosage has not changed. So, what is the mechanism behind this? Amlodipine works by dilating your arteries, allowing blood to flow more easily and reducing overall pressure. However, NSAIDs, like ibuprofen or naproxen, reduce a substance called prostaglandins. These are natural chemicals that help keep the blood vessels in your kidneys open. When prostaglandin levels drop, blood flow to the kidneys decreases. The body begins to retain sodium and water. The result? More fluid in your bloodstream. And that pushes your blood pressure higher. And this is not just theory. A meta-analysis published in the medical journal The Lancet found that regular NSAID use can increase systolic blood pressure by approximately 5 millimeters of mercury. That may not sound like much, but studies show that an increase of just 2 millimeters of mercury is enough to raise the long-term risk of stroke and heart disease. The U.S. Food and Drug Administration, FDA, also warns NSAIDs can cause fluid retention and may blunt the effects of blood pressure medications, especially calcium channel blockers like amlodipine. So, who is most at risk? First, adults over 60, many of whom take NSAIDs daily for joint pain. Second, individuals with kidney disease, heart failure, or a high-sodium diet. And finally, patients already on multiple blood pressure medications, such as diuretics or ACE inhibitors. So, what should you do? Only use NSAIDs when truly necessary, at the lowest effective dose for the shortest possible time. Ask your doctor if acetaminophen, also known as paracetamol, could be a safer alternative. If you must use NSAIDs, monitor your blood pressure more closely. And finally, report any swelling, sudden weight gain, or shortness of breath to your doctor immediately. Number 4. Grapefruit. If you enjoy eating grapefruit or drinking grapefruit juice, it may seem like a healthy habit. However, for patients taking amlodipine, it can increase the drug's concentration in the blood and lead to unintended effects. The following symptoms may appear. You might suddenly feel dizzy, lightheaded, or unusually sleepy, even though your dose has not changed. You may notice your blood pressure is lower than expected for many consecutive hours. Here is the reason why. Grapefruit contains compounds called furanocoumarins. These substances inhibit an enzyme named CYP3A4, which is responsible for breaking down amlodipine in the gut. When this enzyme is blocked, amlodipine remains in the bloodstream longer and at a higher concentration. This means it can lower blood pressure more than intended. According to the FDA label for Norlic-VA, amlodipine, grapefruit juice may not significantly alter drug concentration in most people. However, individual responses vary and some people may experience a stronger reaction. A classic study demonstrated that just one glass of grapefruit juice, around 200 milliliters, tripled the concentration of a similar drug, felodipine. Although amlodipine is less affected, the interaction is still significant enough to be important in clinical practice. Who should be most cautious? Older adults, especially those over 60. People with reduced liver or kidney function. Those taking other medications that are also metabolized by the CYP3A4 enzyme. And anyone who is sensitive to blood pressure changes. What should you do? Avoid grapefruit and grapefruit juice while taking amlodipine. That is the simplest and safest guideline. Merely separating the time between consumption and medication is not sufficient. The interaction can last for 24 hours or more due to prolonged enzyme inhibition. If you enjoy citrus fruits, speak with your doctor about safer alternatives like oranges, which do not cause this effect. And always consult your pharmacist if you are unsure whether a fruit or supplement is safe to take. Just one fruit, grapefruit, can halt your medication's metabolism and cause your cardiovascular drug to act more powerfully than expected. Number 5. Cold medicines. The hidden blood pressure spike. When a stuffy nose hits, many of us just grab an over-the-counter cold remedy. They seem harmless. But if you're taking amlodipine, some of these products can quietly push your blood pressure in the wrong direction. The main culprits? Decongestants like pseudoephedrine and phenylephrine. You'll find them in popular cold and flu tablets, nasal sprays, and all-in-one products at every pharmacy. How might you notice a problem? Your blood pressure, which was stable on your medication, suddenly starts climbing again. You might feel your heart racing or pounding, or get headaches that feel sharper than usual. These aren't random. They're directly linked to how decongestants work. The mechanism is pretty straightforward. Amlodipine lowers blood pressure by relaxing your blood vessels. Decongestants do the exact opposite. They constrict blood vessels in your nose to reduce swelling and congestion. But that effect isn't limited to your sinuses. Blood vessels throughout your entire body constrict, raising your systemic blood pressure. The American Heart Association specifically warns that pseudoephedrine can increase blood pressure in patients with hypertension, even when it's well controlled with medication. Clinical evidence backs this up. A review in the Journal of Clinical Pharmacology found that pseudoephedrine could raise systolic blood pressure by 1 to 2 millimeters of mercury in healthy adults, but the effect is often stronger in those with hypertension. Even a few millimeters matter. A 2 millimeter mercury rise in systolic pressure can increase your stroke risk by 10% over time. NHS guidance also notes that decongestants can blunt the effectiveness of blood pressure medications, including calcium channel blockers like Amlodipine. So, who's at higher risk? Adults over 60, patients on multiple blood pressure drugs, those with poorly controlled blood pressure, anyone with a history of heart disease or arrhythmia. What's the safer approach? Always check the label of cold and flu medicines. Look for pseudoephedrine or phenylephrine. If you need symptom relief, ask your pharmacist about non-decongestant options, such as saline nasal sprays or antihistamines that are safe for your blood pressure. For pain or fever, acetaminophen is generally considered a safer choice. And if you notice persistent high readings or palpitations after taking a cold medicine, contact your doctor promptly. Remember, a single cold pill might just undo days of blood pressure control, something no patient expects when they're simply trying to feel better. Number 6. Prescription drug interactions. Not all medications play well together, and for amlodipine, the risk of hidden drug interactions is real. Some combinations increase side effects, others reduce the benefit entirely. And here's the key point. Many of these interactions involve common prescriptions, not rare, exotic drugs. Let's start with antibiotics. Macrolides, like clarithromycin and erythromycin, block the same liver enzyme, CYP3A4, that normally breaks down amlodipine. The result? Higher drug levels in your bloodstream. Patients may suddenly experience swelling in their legs, pounding headaches, or even low blood pressure after just a few doses of antibiotics. Antifungal medications can act the same way. Ketoconazole or itraconazole are potent CYP3A4 inhibitors. Combine them with amlodipine, and the drug's effect may double, without changing the prescribed dose. On the other side, certain anti-seizure drugs, like carbamazepine or phenytoin, speed up liver metabolism. This lowers amlodipine levels, making blood pressure harder to control. So, the very medicine meant to stabilize your pressure becomes less reliable. And it's not only these categories. According to the FDA, combining amlodipine with other heart medications, such as beta blockers or ACE inhibitors, can increase the risk of dizziness and fainting, especially in older adults. In fact, up to 15% of patients on combination therapy report symptomatic low blood pressure. Two people may take the same 5 milligram tablet. But if one also takes an antifungal, the real effect might feel like 10 milligrams. Who is most at risk? Adults on multiple prescriptions, often for high blood pressure, diabetes, or heart disease. Patients recently hospitalized, where new antibiotics or antifungals are often added. Older adults with slower drug metabolism. What's the practical step? Always keep an up-to-date medication list. Show it to every doctor, dentist, or pharmacist you see. If a new drug is prescribed, ask directly, does this interact with amlodipine? And if you notice sudden swelling, unusual fatigue, or dizziness after starting a new prescription, call your healthcare provider right away. Amlodipine is effective, but its safety depends on what else you take. Drug interactions can turn a stable treatment into an unstable one, sometimes overnight. Number 7. Amlodipine and anesthesia. What every patient should know. Imagine this situation. A patient arrives for a simple, planned surgery. They've been on amlodipine for high blood pressure, and everything's been stable for months. But as soon as anesthesia is given, their blood pressure suddenly drops, much lower than expected. The surgical team has to respond quickly to stabilize them. Why does this happen? Amlodipine lowers blood pressure by relaxing the blood vessels. That's how it works. But anesthesia, whether general or spinal, also relaxes blood vessels and lowers blood pressure. When both effects happen together, blood pressure can fall too far, too fast, and that can be dangerous. This isn't rare. Studies and real-life cases show that some patients on amlodipine experience sudden low blood pressure during surgery, sometimes needing IV fluids or medications to raise it quickly. Who's more likely to be affected? Older adults. People taking multiple blood pressure medications, patients undergoing long or complex surgeries. In fact, research shows that calcium channel blockers like amlodipine can cause more noticeable drops in blood pressure during surgery than other blood pressure drugs. Why is this important? A short drop in blood pressure might not be a big deal, but if it lasts too long, it can reduce blood flow to vital organs, like the heart, kidneys, or brain. This increases the risk of complications, heart strain, kidney problems, or delayed recovery after surgery. So, what should you do as a patient? Tell your doctor and anesthesiologist if you take amlodipine. Don't stop the medication on your own. In most cases, you'll still take it on the day of surgery, but your care team will adjust the anesthesia plan accordingly. If you're in a higher risk group, your doctor may suggest holding or reducing the dose before certain types of surgery. Amlodipine and anesthesia are not a dangerous mix, as long as your doctors are prepared. When the medical team knows your medication history, they can plan ahead and keep you safe. Before we finish, let's return to the 3 risks you should never overlook while taking amlodipine. Number 1, excess salt. It may look harmless, but too much sodium can undo your medication. Swelling in your ankles, sudden weight gain, and rising blood pressure are clear warning signs. Number 3, NSAIDs, the common painkillers. Ibuprofen, naproxen, even pills you grab without thinking. They can raise blood pressure, cause fluid buildup, and make amlodipine less effective. Number 7, anesthesia and surgery. If your doctor doesn't know you're on amlodipine, your blood pressure could crash during an operation. This is one mistake that can turn critical in minutes. If this video helped you, give it a like and share it with someone who may need this information. And don't forget to subscribe and hit the bell so you never miss an update on safe blood pressure management. Stay informed, stay healthy, and thank you for watching.